And then I'm going to start the recording. And you're ready to go.
Great. So Katie, can you please start us off with roll call?
Yes, Mr. Badger,
Here.
Mr. Bleefeld,
I'm here.
Mr. Frank,
Here.
Mrs. Ginsburg,
Here.
Mrs. Heyman,
Here.
Ms. Karyonikis,
Here.
Mr. Stoloff,
Here.
Mrs. Walsh,
Here.
Mr. Antonio,
Here.
Alex Gandea,
Here.
Olivia Walsh,
Here.
9 present, 0 absent, and 2 student board reps this evening.
Thank you. So I'd like to welcome everyone to this March 16th, 2021 special meeting of the Wissahickon School District's Board of Directors. Tonight, we'll review the instructional program plan that is in place for the remainder of this school year, including the rationale and considerations that led to it. There will be an opportunity for Q&A from the board, as well as an opportunity to hear comments from the public. And we are fortunate this evening to be joined by Dr. David Rubin from CHOP, who our superintendent will properly introduce in a minute. Jim?
Okay, thank you. We do have a very short slide presentation, and we'll get to Dr. Rubin in 1 second. So I'm going to go ahead and share my screen, and we'll get going there. Let's see. Everybody see that?
Yep.
Okay,
Yes.
terrific. So tonight we're going to have a conversation about the instructional program plan that we have. It's the what's happening tonight is the instructional program is a discussion. Let's just go. Actually, this is a little better. Yeah. We're going to have some insights from Dr. Rubin, who I'll introduce in a second. We'll discuss the plan for the balance of this school year, and then a preliminary look into the fall and the start of next school year. So just to set the table first as to an overview of the elementary grades, to get everybody on the same page, we have 5 days in person, actually all year in the grades K to 5. And as you may recall, about 75% of the students are choosing to be in. We have 6 feet of distancing at the elementary level. We did a number of things to make sure that could happen. And we do offer a 100% virtual option, which is our teachers and families chose once in August, and were able to make a different choice if they wanted to in January. We don't have any plans at this time to offer any more changing. And this year, I know there's been some requests for that. Is switching teachers and making changes at this point is rough. You'd have to meet a new teacher, meet new classmates. That's really not advisable. We barely have any space left anyway. And we really don't want to move away from the 6 feet, which we're going to talk about here in a little bit more. Fall is a different story. We anticipate being back to normal and with normal distancing, normal table setup, and or maybe perhaps the desks facing each other, student desks, a normal look in a classroom. There will be some virtual option of some sort. The key is families will have time to plan. So we'll figure out what we can do in the fall. We'll get it all publicized and shared so that there will be enough due process time to actually make a choice, an informed choice. And then for the rest of the grades, and to finish the overview section, as you know, in grades 6 to 12, middle school and high school, we have a hybrid program in place right now, which is every other day. We took the first marking period, we had to be 100% virtual to get the right teachers' certifications figured out. We did that. And since November, we've been back in hybrid mode, which is every other day with 6 feet of distancing. We also have a live streaming option for those who prefer to be home. And so in that case, unlike the elementary school where there's a dedicated virtual teacher, in secondary grades, they live stream from the classroom. They have the same teachers they normally would. In advance of each marking period, families are offered the choice if they want to change to hybrid or change to virtual. And the key is our 6 to 12 students are back in school. They're not back in school as often as some people would like. I think we might as well just admit that right from the start. We're trying to find a common ground. And that's going to be the theme of all of this. We're trying to find a common ground in terms of how people are responding to the pandemic. It's very different ways, of course, we know that. For the rest of this school year, our plan is to continue with the hybrid, which is every other day. And then in the fall, we anticipate being back to normal, which is the normal 5 days. There will be some sort of virtual option in the fall. Don't know what that looks like now, but I would not anticipate it being live streaming, because part of the problem we're up against is the experience in the classroom for those students who are in that day is compromised, because then the teacher has to spend a good portion of the class paying attention to the screen while the students are at home. It's not ideal, but no one can argue that that's a great situation. It's better than nothing, but we know it's compromised. So in the fall, I would envision the virtual option being something other than live streaming. But we're not going to spend too much time tonight in the fall. I just wanted to sort of set the stage. So our guest medical expert tonight is Dr. David Rubin, with us from CHOP. He's the director of the policy lab at CHOP. His area of expertise, among many others, is health services research. And I can tell you that along with Dr. Val Arkush and her team at the Montgomery County Office of Public Health, Dr. Rubin has been with us here in the county with us superintendents every step of the way. And we all appreciate very much the partnership and the incredible amount of time that Dr. Arkush is putting into this, and also Dr. Rubin at CHOP, and he has a team there as well. So without further ado, we're honored to have you with us tonight, Dr. Rubin, and if you would, you can take it away.
Yeah, thanks for having me. I appreciate the opportunity to talk to you, the Wissahickon School District. I use these opportunities when I talk to school boards and community just to update you on where things are in terms of the moment we find ourselves in the pandemic, also what we're learning and what we still don't yet know. I don't come here tonight to inform your decision. That's your decision alone, and it's based on a lot of discussion with your school community and the knowledge of your own structural facilities, et cetera. But I can at least provide an opportunity to answer some questions and talk in general about how we've tried to advise the region and be nimble to different moments in the pandemic. Clearly right now, there's a lot of interest in how students are returning for in-school education. We've got a lot of schools moving forward with plans to resume in-person instruction. Some of that is based on an emerging literature that I think is getting stronger in terms of the safety of in-school instruction, particularly with strong protocols that are focused on masking, distancing. The CDC calls it 6 feet to the greatest extent possible. I think physical distancing is still one of the #1 interventions in preventing transmission. The unanswered question has always been, how much does that mask confer value to reducing the likelihood of transmission or secondary transmission from an exposure in school? And there'll be some compelling data coming out, particularly in the next week or two, demonstrating that there is a fair amount of value when schools are really committed to the protocols, particularly among younger students. I think the data is still a bit inconclusive among older high school students. There's been some studies that have shown some significant transmission. The older students are a little bit, they march to the beat of their own drummer, and compliance is an issue. High schools are moving around a lot. They're much more densely crowded. There's a variety of reasons. The number of activities and the social mobility of students, particularly at high school level, doesn't mean you can't do it. I think it takes a lot of work, and there are different strategies that we've been deploying in the region. First, by helping schools develop their safety plans, and then by bringing a testing program to the region called Project ACET, which has now grown to include over 40 public school districts, 25 independent charters, and schools that work with underserved children or children with special education limitations, and as well as the School District of Philadelphia, which has used the testing program as well. And that can provide, on top of your safety protocols, additional layer of assurance testing that things are going well, and while removing potentially contagious individuals earlier in their infectious process so that they don't have an opportunity to potentially cause risk within the school day. I think the data in that context, is on your side, and we're finding ourselves at a time when overall since January rates have improved greatly, but they've kind of stalled out. And some of you may have seen an article that came out just a couple hours ago today. We are seeing stalled rates now in the Northeast, the Mid-Atlantic, and particularly the upper Midwest, some similar patterns in terms of fanning out that we saw in the fall. But the difference now is we have growing vaccinations, we have the coming spring. And I think some of this is to be expected as communities are reopening. The virus will resurge a bit, but more of our vulnerable are protected. And so we're likely to not see the surge that we saw in terms of hospitalizations, but within age groups, particularly among working adults, it's still possible. And so it's going to be a bumpy road here, I think, through the next 4 to 6 weeks, partly because of spring fever and partly because of spring break and the spring holidays. But it's a reminder that as much as we want this all to be over, now's the time to double down on the things we've learned have worked the entire time. We're thrilled that the teachers and the staff got moved up appropriately to get their vaccinations over the last couple of weeks. But we would also remind folks that when you look at a school building, most of the individuals in that building, including some of those staff who opted not to take the vaccination, will be unvaccinated. And in congregate settings, the CDC, even as they relaxed restrictions for vaccinated individuals who gather in private residences, there's a section of that document where they talk about congregate facilities really focusing on their assurance testing plans. And we are advising school districts throughout the area, even among vaccinated employees, to continue increasing the volume of their assurance testing of staff and high-risk students, because now is the test with some resurgent transmission as communities reopen and repopulating classrooms. This is when schools are going to be tested a bit, sort of the final dance in this whole process, we hope, because we do foresee, like Jim talked about, we do foresee fall being much different because all adults by then will have been offered vaccination. We anticipate the older kids being vaccinated at some time late summer and fall, should the safety trials work out as we anticipate they are likely to do. And so next year school will look a lot more normal than it does now, but we still have, a period here that's a bit delicate, and we're trying to get back to as much normalcy as possible. So with that, I'll turn it over to questions. Those are my introductory comments. I'm happy to answer your questions as you see fit.
Board members, anyone want to start us off? Amy, I see your hand up.
Thank
And then
you.
Ron.
First, Dr. Rubin, thank you so much for being here with us tonight. We really appreciate your time. You mentioned that you've been working with a number of different school districts, correct? You've attended several meetings?
Yep.
And what sort of strategies are the schools that you do see opening? Because I would like to see our students back in school. What strategies of those schools that are opening to 5 days a week, what do you see them doing, or what recommendations are you making to them so that they can open 5 days a week?
Well, look, you're relaxing a key part of your mitigation plan. And so whenever you relax one aspect of your plan, you strengthen the other areas of that plan. These are like multi-layered plans. And so you can make up some benefit by working with the students and the teachers around their masking, assuring that they're wearing them appropriately. Masking is still the number one intervention, that and distancing in the school. Then you could, we see schools flexing to outdoor space or to flex space to maintain 6 feet wherever possible, even though they recognize they're going to have to come within that 6 foot barrier to get all their kids back. There's still an emphasis. You don't just throw them all back. You try to do the best you can, take advantage of the space that you have in the coming spring. And then, for many schools in our area, they're also they're doubling down on their assurance testing program because, that level of weekly testing in particular can really decant some potentially contagious individuals at the doorstep while assuring the rest of the community that you're not seeing an uptick in rates as you kind of reopen. And so there's a variety of strategies that you can deploy. Distancing is obviously an important strategy, but we all recognize the need to get our kids back. And I think that the data is demonstrating that you can do this by focusing a lot of attention on these aspects of your safety plan that can really help you manage through times when cases are actually pretty high in the community.
And with regard to distancing, I understand the CDC is still 6 feet. Is that correct?
They're 6 feet to the greatest extent possible when you achieve a certain threshold that involves an assessment of test positivity and regional case incidence. We've tried to avoid the absolutism of the thresholds themselves. Like you'll notice that our test positivity in the region right now is at a range where you could repopulate, but the case incidence is kind of stuck in that 100 to 120 range. And some of that is an artifact. We're just doing much more testing than we used to. And so to me, it's about the trends and it's about the knowledge of what the safety data is showing you and your experience. Wissahickon, I have to applaud. You guys have been out ahead of other districts in terms of getting kids back since the beginning. And your safety protocols really well, and your tolerance for risk. And I think that's what's most important in making these decisions.
So I've heard that there could be some consideration for reducing that to 3 feet. Taking in consideration that we are doing really well with masking and we're cleaning, is it possible that we could do with less than 6 feet? It sounds like.
I think if you're going to see that, I am in regular touch with the CDC folks because we're working with them on the ACID program. I have not heard them say they're going to make a recommendation of 3 feet. If they did, they'd likely make it principally for the elementary students because I still think the data is inconclusive on the older kids. But I think you're going to see some interesting data that suggests that particularly the younger kids have done well at lower amounts of distancing, when there's strict adherence to some of the other parts of the safety protocol, particularly the masking.
Okay, thank you.
Ron?
Yeah, about how often do these schools test? And how often do we test, or do we test at all?
Well, I'd let the superintendent discuss their testing plan, but do you want to start? You want to answer that first?
Sure, thanks. You might recall we have a testing program that is going to get board approved on March 22nd. So the answer is we haven't started yet. Our intent is to start immediately after the spring break. And the way it's designed is any district has to start with adults, which we'll do. I don't know yet to the extent we will. We were thinking about athletes or maybe high needs special education classes where the distancing isn't quite as common. And then once we are allowed, I would like to extend it to the spring sports teams. Minimally, they're all at the high school. We could do it in a pretty efficient manner, and then we could extend it to the high school staff since we're there. And then now we have the older students and teachers of the older students covered.
Yeah, let me talk a little bit about why the emphasis on the staff. Since the beginning of this pandemic, the contact tracing data is pretty strong. That the highest rates of infections have been among staff, and they're often community acquired. They're adults. They're mobile in their own communities. I don't remember if it was you, Jim, or one of the other supers mentioned that when you think about schools, everyone talks about the students, but these are one of the larger employers in the regions for adults. And adults are congregating together in these school settings. And so that's what makes them especially at risk, particularly on staff to staff transmission, to some degree, staff to student. We've seen less frequently student to staff, sometimes in the special needs classrooms. And so there was a study that just came out from New York City this past week that some of the people participating tonight may have glanced at or heard about, but it demonstrated that 80% of the infections in November and December out of New York City that were linked in school were related to community-acquired infections among staff. Now, so that's why we focus the core of the program on staff assurance testing, because you go after the most high-risk individuals. Now, some people would say, well, we just got vaccinated. Do we still need to do that? Well, number one, if you think about the J&J vaccine, I think the likelihood that if you got infected in school that you'd be hospitalized or have a severe reaction is pretty low. And it was non-existent. The J&J vaccine trial was great, but it was only about 75% effective in reducing milder infections. And so staff can transmit this virus. They can transmit this virus to other staff members who have not been vaccinated. Among the school, if you have an outbreak, those kids then go home. And many of those parents have not been offered vaccination. And so what you want to be doing is focusing right now is not, the temptation to reduce the staff testing is actually the wrong answer. You want to actually increase it as we move into this period of a little bit higher resurgence so that you can decant as much risk from the staff, the high-risk students like the athletes and the special needs students, and particularly for the next 4 to 6 weeks as we move deeper into spring until we are clearly past what I think is going to be a bumpy long tail here. I'm not referring to it as a wave. I think a wave is more like what we saw in November, December, but there's some areas in the country, in like Michigan, for example, that are really struggling right now. And we just don't want to get there. And I think we want to keep schools on the path that they're going on. I think we're recognizing that we can have in-school instruction pretty safely, but it takes a fair amount of work until we get all the adults around us vaccinated.
So are you envisioning weekly or daily checking for the staff?
That would be weekly testing of the staff. And we've created a program that's actually fairly terrific in terms of how easy it is. It takes about a minute or two for the staff to roll through. It's a rapid test. They get texted to their phone. We have confirmation testing of those asymptomatic individuals. If they have a positive test, the results are returned immediately. It's pretty, the schools have been doing, we've done over 40,000 tests to date. We hit 10,000 last week in the region. That's likely to double within the next week or two. And so it's growing very quickly. We've designed in a way to make it very easy and not disruptive to the school day. And I think the staff, we have this saying that COVID response is a team sport. These programs work by full participation. I think if you imagine, let's say a lunchroom where there's 10 of you in there and you're having lunch, you're spaced, and only 3 of you have gotten tested that week. There's 7 of you haven't gotten tested. Do you feel better if all 10 of you have tested negative, or if 3 of you have been tested but 7 haven't? And that's how these programs work. They decant the risk in all these settings where people might be congregating.
Thank you.
Tracy, do you have a question?
Yeah. So I just wanted to clarify, Dr. Rubin, you had said something along the lines of at the secondary level, the students seem to have a higher level of transmission.
Yeah, the
than
adolescents.
the younger kids.
Yeah, the adolescents are more like young adults that way. They're just much more mobile, and so their transmission, the severity of illness is less than it would be in older adults. We don't worry about the kids, even the adolescents, so much. I mean, we've seen some rare incidences, and we've had them at CHOP of that inflammatory syndrome, but by and large, the kids do well, and the risk of hospitalization is below the flu. They just can transmit, and they certainly can transmit within their social circles and in their family. And we've seen that most of the LinkedIn school transmission outbreaks, the ones that have been substantial, have been among high school students. So that's where, so you recognize that. But that said, the Missouri data that's about to come out this week showed that with a fair amount of work, you could even get some high school kids back in, but you just need to be on them in terms of compliance around their masking. The testing certainly helps, particularly in your high risk groups. But yeah, we have to recognize that the high school kids are a bit different. That said, it's a trade-off because we also know that social isolation is taking its toll on these kids. We've certainly heard from superintendents throughout, particularly since January, of increasing disengagement, particularly in the older kids with their virtual instruction. And so, it doesn't mean you don't try and you don't move forward. It's just that you got to work pretty hard on your safety protocols to make sure it's going smoothly.
Okay, other questions? Oh yeah, go ahead, Ron.
Yeah, I have a kind of a long-term question. Where do you see the situation in 5 or 6 years? I was reading the other day that there was some theory that most of the modern flus are descendants of the so-called Spanish flu. Is that the kind of thing that we can expect in the next 5-10 years?
Yeah, I mean, we all would love a crystal ball, but I think that the 1918 flu that you talked about is a good example here. The reason why we got into such trouble this year is we, as a population, we had no immunity to this virus or exposure to this virus. It had a higher lethality than the average flu, and particularly to not, everyone gets infected at once. And so you see the hospital capacity crisis that we went through at various times, and particularly during the winter in many locations with field hospitals being set up. We're likely never to eliminate this virus. So for those looking for 0 cases to go back to their lives, that's not going to happen. But whether we've had either natural infection or particularly acquired immunity via vaccination, if we can build that up pretty high, then what we suspect is that as an endemic virus, this may return with seasonal peaks in the winter, but its virulence or its severity would be more like the flu or a common cold. And so therefore the calculus changes on what we would do. I think that the note of caution would be, now that we have a new flu that will be with us in winters in particular, as we move along, there are people who are still going to break through and be ill, particularly older members in our community. And now you put that on top of flu and other viruses, there may be times like if particularly next winter, I think people are still uncertain of just how much hospital capacity is going to be a challenge, not necessarily just for COVID, but for flu returning as people aren't wearing masks, et cetera. We might go through some time limited interventions, nothing of the level that we went to this year, but we might wear masks for a month or so to try to keep rates down, particularly if we see our local hospitals struggling with capacity, just to kind of help ease up the rates a little bit. Certainly be a little stricter around sick policy than we've learned to do that. Maybe we'll position testing to be a little available for a short period of time. That's only if we're finding ourselves looking at a seasonal peak next year that's higher than we might anticipate. But we'll get used to this virus and it'll kind of blend into the background of all the viruses and all the risks in our life. Life's not without risk.
Paul, you look like you had your hand raised.
Yes, Dr. Rubin, you talked a little bit about transmission. I'm curious as to whether you have any data as to what may happen to transmission rates if we go to less than a 6-foot distancing.
Well, again, it all matters on how I think the likely when you go to less than 6 feet, and I think Dr. Arkush would say this too, the probability of a transmission event that might be linked goes up. But you can reduce that significantly with appropriate use of masking, and if you can reduce the number of contagious individuals, you have less events where that's likely to occur. And so I think the data that's about to be released by the CDC is going to reveal that you can do it with good masking and good attention to the protocols of hygiene, et cetera, that schools have been able to maintain very low secondary attack rates and very low transmission, particularly among the students compared to the community. And I think that's what's really important here. And now with the teachers being vaccinated and having some benefit there, I think it just means that it's not inevitable that you're going to have outbreaks because you went to 3 feet. I think we now know that these protocols can do pretty well, even in distancing under 6 feet, to confer safety to the classroom. Another thing that you have to remember too for your staff is that you're still distancing them, and so the risk for them remains lower because they're going to be distanced hopefully more than 6 feet. The more the better, even in the classrooms as they increase. I think this becomes more about transmission among the students, and then certainly back to their families when they go home. And I think that can be prevented pretty well. Just as an example, we've done 40,000 tests to date as of last week, and our positivity rate was 0.2% in those tests. That's pretty good. It's increased a little bit. It went, hit 0.3% last week, but that kind of rate gives you the kind of assurance that the rates are lower in these schools than we had suspected, and that there's a fair amount of safety.
Dr. Rubin, in Wissahickon, as Jim started off with us earlier, the K-5 students have been in person every day. Masks and 6 feet distancing has been the protocol. And our students at 6 through 12, or older students, have been since November in every other day, masks and 6 feet distancing. As we go into the fourth and final marking period of the school year, the plan has been to maintain like that hybrid schedule for them, as well as 100% virtual for students who want that. But there's been increasing, I think, interest, I'll say, from members of our community that have been lobbying or advocating for us to go to 5 days in person for 6 to 12 students. And the only way we could do that logistically would be to relax the 6 foot distancing requirement. given, kind of our local context, I mean, what's your thought or perspective on?
Well, I think it's an individual school choice. I think that, we're certainly seeing schools make that choice throughout the region, but it depends on the risk tolerance of the community. I mean, families have opted into certain expectations through the year. I can't speak to Wissahickons' preferences in terms of your school community. But I really do think that is an individual decision about your risk tolerance, your knowledge of your school community, the routines people have gotten used to, the amount of time you have left in the year. To some degree, the fact that we're seeing some increased transmission and spring break, you just have to decide what feels right for your community. I don't think you'd be wrong to go for it. I also don't think you'd be wrong to say, look, we're used to our routines now, and I think that is that's a decision that I think your board needs to reach for knowing your own community.
Thanks. Marshall.
Yeah, Doctor, good evening, and thanks for coming tonight. I know we've talked about this 6 foot distancing quite a bit tonight, and I have looked at the policy reviews which were created by your policy lab, including the revisions in August and November and December. It still mentions the 6 feet. You talked about the new studies that are coming out. We know that there's one in Massachusetts that people are talking about. You talked about another one tonight, and there's been some talk about reducing it to 3 feet. Is there a plan for your policy revisions to change from the 6 feet that you've had throughout your documentation?
Well, you'll see, I actually think we are. By saying 6 feet to the greatest extent possible, we've been writing for several weeks now that we recognize that schools are going to have to go down to 3 to 6 feet to get more kids in the classroom. But our position is you should maximize 6 feet wherever you can, particularly at a time of high transmission. But, whether we say 3 feet is what you need, what you can do, I think we're updating our guidelines right now, so stay tuned on that. There's a brisk discussion. It's not my decision alone. We have a whole infectious disease team, so stay tuned on that a bit. And certainly, I think in the elementary kids, I think you'll see some updates there. But I think we've already given license to the idea that you're going to get down to 3 to 6 feet, but you're going to have to do it with significant mitigation. And if I were a superintendent or a school board right now, I'd be thinking about every moment that was high risk in the school where I could maintain 6 feet. Like, for example, I've seen some really, really great ideas around school lunches staying at 6 feet and how they're going to accomplish that, even though the classroom's going to be at 3 or 4 feet with the kids with the masks on, because that's a higher risk moment. The masks are off, the kids are yelling at each other, they're sharing food, all the above. And so, to me, the 6 feet to the greatest extent possible, I really like that language because it gives you license to recognize that once you break the barrier, that's, there's not a lot of difference between 4 or 3 feet if they're wearing the masks. In terms of the risk, I think the risk increases, but the mask confers a fair amount of protection and much more than we realize based on some of these studies that are coming out in the CDC. The Massachusetts study, I'd be careful to overinvest in that study. That was a convenience sample of schools reporting to a website. The average enrollment they listed in that study was 2,000 kids per school district, and most of our districts are not generalizable from their districts that they reported there. I think that study to me has some concerns in terms of just the way the measurements were done, but the weight of the data is demonstrating with good masking and safety protocols that schools can function for in-school instruction and at higher levels of transmission in the community than we suspected last fall.
And that's a good point, because as you said, while we may consider reducing to a certain extent, we're not going to mitigate the other areas, such as reducing the use of masks or ventilation or reducing density of people, correct?
Yeah, use your flex space, use your outdoor space. You get creative. I still think we got a little bit of a journey here ahead. We're getting closer to the end, but our rates are still where the summer peaks were last summer, and there's still a fair amount of risk for transmission there. So you just do the best you can, but you prioritize getting your kids back. I mean, that's what I think the 6 feet to the greatest extent possible is giving you license to do.
All right. Any final questions for Dr. Rubin? All right. Well, Dr. Rubin, I really appreciate, and we all really appreciate your taking time to be with us this evening and share some of your medical expertise and knowledge and insights on this whole COVID-19 challenge.
Yeah, absolutely. Yep. Have a good one, everyone. Good luck with your decision. Bye now. Yep.
All right. Thanks, Dr. Rubin. Okay. Jim, you have more to share.
We're going to share a few more, and then we'll open up to other. I mean, we can discuss what he had to say about those other things as well.
Mhm.
Okay, so in grades 6 to 12, with some details, it gets at a little bit of what we're talking about, the 5-day versus not, and why are we not? Really, the crux of it is we can't guarantee 6 feet, and we heard that it's perhaps not necessarily unanimous in the recommendations, but there's research on either side of that coin, and he's on top of this as anybody else. In a middle school, we have very few classrooms that can absorb anymore. At the high school, it's a little bit different. There's a number of classes that don't have that many students in it, but these schedules, remember, they change. So the student might have a specialized class over here that has normally not that many kids anyway, and then they might go over to a more core class and it has more. And so we just can't guarantee 6 feet. And that's the crux of the matter. Another thing is that I feel that the families made decisions based on our stated commitment of 6 feet. They chose hybrid or not. And many are in hybrid now. And with that knowledge that when we said we were going to commit ourselves to 6 feet. So the research is on either side of the fence. But the thing is, to change away now means that some students who have been in every other day, and first we should probably just get on the table that every other day, and we said it previously, is not ideal. We have students in school and they're seeing each other, but they're not seeing all their friends because some of their friends are in the other day, or some are 100% virtual. But if we change now, that means some students who have been in since November are going to have to stop coming in because they have a family situation at home. They're high risk. And yes, we're all getting vaccinated faster as we can, but I'm not sure the rest of society is going to get as vaccinated as we'd like by June. So, and we have 2 months. So if we were having this conversation in November, it might be a little different because then the routines and choices could be longer term. For 2 months, that's kind of like, marking period is 45 days. So for seniors, it's a good number of days less. That's what we're talking about. And again, in fall, it's different. So there are different approaches to this in the area. I listed some of the approaches here. We have some doing hybrid, some are 4 days a week. That 5th day is totally asynchronous. We're trying very hard to stay away from asynchronous as often as we can. So our virtual days are synchronous. Some have 4.5 days with an early dismissal. Okay, that isn't ideal either. All these have pros and they all have cons. And then there's those variables we talked about. Lunch is really, really critical in any of these environments. We've got some traffic concerns. Many fewer students are riding the bus this year, so we've already got a traffic snarl, and it could be worse. And then quarantining. The quarantining for if you have less than 6 feet, then and we have somebody with a case, everybody around them has to go out at a school in quarantine. And we've been able to minimize that, not eliminate, but minimize it with the 6 feet. And so there's another variable to consider. So we're getting close to the end here and we're going to open up for questions, but I would just like to say that no matter what any district does, ourselves included, it's just not going to feel normal until the fall. And maybe fall might not be totally normal, but fall is going to be much, much better. Doing something for the next 45 days in this environment is not going to make it feel that much more normal. It's going to maybe be a tiny bit for some, tiny bit less for others. Some are going to like whatever a district decides to do, some aren't. And really our goal is to find a reasonable common ground. That's what we've been trying to do this whole year. For now, we believe the common ground is hybrid. And then for fall, we believe the common ground is 5 days a week. So that's the end of the presentation. I will, unless somebody wants me to go back to the slide, I'll stop the share. You go with that?
Okay.
Okay.
Questions for Jim? Yep, Ron?
Yeah.
And then Amy?
Are you familiar with how some of the parochial and private schools are running 5 days a week? And are they doing 3 foot, 6 foot, or just taking their chances? And how are they managing to do this?
I'm not familiar with the parochial approach as I am with all of the other public schools. I think some of the private schools just have smaller classes generally, and they are offering a virtual option if you want, but I don't think we can compare apples or oranges. It's just the circumstances are different. I can't speak to parochial. I was going to hypothesize that they are just okay with less than 6 feet, but I don't know that for sure.
Amy?
James, I had suggested a couple of weeks back about doing a survey. I know we didn't do one, but I'm just curious, I've probably received 20 or fewer emails from parents. We saw the petition that was sent to us had about 52 signatures on it, I believe. Like, it doesn't seem like there's like a ton of people that necessarily want to go back. Isn't it possible that we could open it up to those hybrid students that would like to return and let those students that would like to go 5 days a week go 5 days a week, if it's not a large number?
The problem is we would have to say to everybody, we can't any longer guarantee 6 feet. It could be 6 feet or it might not be. We won't know. And so it's really about the 6 feet and people having that knowledge that it's 6 or it's not.
And as the doctor said, it's 6 feet to the greatest extent possible.
Mm-hmm.
And I understand that people made that decision a couple months ago based on the understanding of 6 feet, but the situation, is evolving. People are getting vaccinated. Our teachers are getting vaccinated. We are heading into spring, and we'll be able to have hopefully more outdoor time, have more windows open. I love to see if we could present that opportunity to our hybrid students, that for those that would like to return 5 days a week, because it seems like, again, we didn't do a survey, but the numbers, I don't know if it's a high number that are necessarily want to return 5 days based on the responses we're receiving.
Other comments or questions for Jim? Zephy, I see your hand raised.
Thank you. I am having some internet issues and my Zoom keeps dropping. So hopefully you can hear me okay. But I had a very similar comment and sentiment really with Amy, because I do feel like there's probably a cohort of students that feel ready and feel like they would benefit with a 5-day return to school. And maybe the question is to our families, like how they feel about, kind of giving up a little bit on that 6 foot rule, and having that guide our, how we navigate through this. And I do think it's an evolving time. More and more people are getting vaccinated. Things are changing. And I know some are more eager to kind of go with that change sooner than later. And I just want to have a full picture from the entire community and our students and our parents to see where they stand and how we can kind of find a middle ground based on our families' kind of desires.
I think at the end of the day, what this boils down to is Jim and his team have recommended and are implementing an instructional plan program for the fourth marking period. And it's based on, I think, his professional judgment and perspective about what's kind of like the best trade-off in terms of risk versus benefit, given the current information that's out there. And as we heard from Dr. Rubin, yes, 6 feet to the greatest extent possible, but there's some wiggle room. But I think at the end of the day, what he said, what it boils down to is sort of the risk tolerance for each school community and school board to determine where that trade-off is. So I think for us as a board, for Jim to, change his course of action, we probably need a majority of the board who's willing to say that they are okay with us relaxing the 6 foot distancing requirement in order to have kids come in 5 days a week. To me, that's kind of seems like, again, the crux of this whole issue here, because even if it wasn't that many kids that wanted to go 5 days, to allow that option to happen, we would in essence have to back off on the requirement that 6 feet is in place, because we can't guarantee. Now, my kids are in high school and they've reported that in certain classes, they might be the only kid in that class that day, but in other classes, there's 8 or maybe 9 kids. It's variable and it's hard to predict. So again, what's currently in place, we can guarantee 6 feet distancing. If we did something different and allowed 5 days, we couldn't guarantee that. So it's really boils down to us as a board, and the majority feel like relaxing 6 feet is something we want to consider. Marshall.
Yeah, Jeff, thanks. I want to make sure we're clear on this. I don't think it's a board decision to relax the rule. That's not our goal, and that's not what we do. If that's what we wanted to pursue, if we believe that there's enough interest in the community, I think that you would have to throw this out to the community, because if you decide that you're going to recommend closing the gap or reducing the 6 feet, that's really something that those who are sending their kids in should have input in. They have skin in the game, and they should realize and they should have input on that then. If that's what we're thinking about doing, then I think it's an absolute disservice to say the board will decide that we're relaxing that, because you, like I, and everybody else on the board have heard from lots of people. And we've heard from people who are satisfied with virtual. We've heard from people who are satisfied with hybrid. And we've heard from people who want to go in 5 days a week. So I think if we're going to change anything, it's not us making the call. But at the moment, I think what we have to do is then throw it out there and say, if this is what you want, if you want 5 days, then you will be doing so first without a hybrid option, because it sounds like that is not a feasible option with 5 days. So we're eliminating hybrid. So you're either virtual or 5 days all in. And people have to make that conscious decision to say, I'm okay with that by reducing the amount of space, and things will change from what I had expected or what I thought. That's fine, but I think that distinction needs to be made. If as a board we want to throw it out to everybody, then by all means, send out a survey and find out who is interested in changing or sticking with the current situation, while understanding that you're not going to be able to keep it exactly the way you want. And I think that's also important for people to make a decision on, knowing that whatever decision they make, it will not be completely what they want, but let's see what people have to say if that's what we believe we should do.
Tracy?
Yeah, let me know if I start breaking up. So I would have to say that I don't necessarily agree with what Marshall said about the having to have all in or virtual. I mean, still think that we could, for the rest of this year, have some form of hybrid. But I do totally agree with what he's saying on if we were to have any kind of contemplation of changing anything, that I would say it has to go out in a survey to the parents because, we are hearing from some people who want to go 5 days, but we are also hearing from people who want to keep it status quo, like it the way it is. They're too nervous to send their kids in 5 days a week. And if other people want to send their kids in 5 days a week, you're taking someone else's decision away from them, or their choice, rather. You're taking that choice away from them. So I really think that before we would think about moving anything, that a survey would have to go out and ask parents, if we were to change it and allow some kids to come in 5 days a week, would that change your opinion of letting your kid go to hybrid? Because there will be some kids that the parents will still want them to go every other day.
Before I get to the other board members, I got the sense that Olivia had something to say, so I want to check to see if she wanted to say something.
Yeah, thank you. I guess the thing that I have one thing that concerns me and then one question. So the thing that concerns me the most, I think, is disruption with, like, if you take away the 6 feet, and I know this is happening in other school districts, then someone tests positive and you have to send home everyone that was within a 6-foot radius of them in their classes. So then you have this kind of, and then those kids are supposed to, quarantine for, 14 days or negative test result, which, like, one, there's no way for you to enforce what they're doing at home if they're following those rules. And then 2, that's really disruptive to, you go into school and then you kind of are just like hoping you're not sitting next to someone who might test positive because you don't want to have to stay home for the next 2 weeks. Like that's a hard schedule to manage, especially if you have to, like, say, leave someone test positive in the middle of the day, then you have to leave in the middle of the day. Like, that's my biggest concern. And then my question, as far as timing, because I know it's on the PowerPoint, like, the middle school is already, there's not a lot of room to add more kids. So would it even be feasible to start this at the start of 4th marking period? Like, there's not that much time left in the year and it's almost spring break. So would the school even be able to implement something like that in such a short time frame?
Jim, do you want to comment on that?
Yeah, I as usual, Olivia is an ambassador here for our district, which I appreciate her wisdom very much. And it will be extremely tight to change. I haven't done a very good job of sharing the teacher's perspective. Sometimes I try not to do that because I was a high school teacher and I don't want to continually fall back on that, but it's not easy now, keeping track of hybrid students, A/B, teaching to a screen, teaching some kids in class. And we know that it's not great for students in that environment, which is part of the reason why so many students choose not to do that. But it's much more complicated to make a change than it seems on the surface, I guess is what I'm trying to get at here. And if we were to ask, we haven't really asked teachers how they feel about a change. We're not talking about, like, the vaccine, that they're going to be, that's fine, that's taken care of. Logistically, the change is not easy. And to Olivia's really good point about the quarantining, private schools, when they have a positive case, they will quite possibly send the whole class home. That's disruptive. It's something we're going to have to deal with in the fall, yes. But I think that the concept of there's not that many, and let's think about the seniors even. So the seniors have a marking period left, which is 45 days. dirty little secret to all the 250 people watching here. Seniors don't go every day at the end of the year. Olivia, you didn't hear that. So what happens is that's even less. That's like, okay, let's just call it 40. Now, if you're in hybrid, you're going to be 20 of those 40. So really, we're kind of talking about 20 days if we can pull this off logistically. If we were having a conversation about fall and a full school year in 180 days, I think it would be different. And when it comes to survey, I definitely hear you about the value of surveys. In this case, I don't know what we would do with that information once we got it back. Let's say we got it back where it's 80% of the students would be interested in 5 days, 20% would have to stop coming to school. Is that something we're good with? I don't know. I mean, again, for 20 or, like for 20 or 40 days, depending how you look at it, I don't know.
I thought before Olivia spoke, Ron and Marshall had their hands up. Ron, and then Marshall.
Well, that was exactly the point, because by the time you create a survey, you get it up, the parents fill it in, send it back, and have it assessed. We'll be left with so few days, it would be not worth the disruption, as Olivia mentioned.
Marshall?
I simply wanted to refer back to what Tracy and I were sort of talking about, and I just don't want there to be a misunderstanding. I'm not advocating that we eliminate hybrid. It was my understanding, based upon the conversations with Jim, that you could not do both. And so that was the clarification I was making, that you have to make that decision knowing that you may not be able to do that. In fact, in preparation over the last couple of weeks, hearing from a lot of people, I spoke to several board members from several other school districts to find out what they did, to see what was feasible or not. And in every instance, when I asked about the possibility of keeping the hybrid, the virtual, and a 5-day option, each one of them in 3 different school districts told me it is impossible. They said they could not do a hybrid with a virtual and a full-time week. Now, again, if we could pull that off and maintain what we need to, wonderful. But it sounded like that wasn't feasible based on those conversations, as well as what we heard from Jim. So that's why I think that, again, if we're going to make a call different from what's been proposed, we're going to need the input from families who are going to need to let us know what they think in that regard. Because as Olivia said, it's not just being comfortable and accepting less than 6 feet. You're also going to be accepting the fact that if more people are in a classroom and somebody tests positive, that may result in a lot more people staying out of school, whether it's for a day or a week or whatever it may be. And that's why I think you would involve everybody in order to find out what their tolerance is, because that's what it is. It's risk tolerance.
Yeah. Amy, I saw you had a comment, but before Amy, I go to you. I want to ask Alex, as another one of our student board reps, if he has a perspective on this discussion that he'd like to share.
Yeah, definitely. I think my perspective is that I was definitely hoping to get some sense of like normalcy and go back to school 5 days for the end of the working period. But I think I'm really torn between both sides and hearing what Dr. Crisfield had to say, as well as Dr. Rubin, about meeting the 6-foot rule expectations and seeing if WIS would be able to do that. So I don't really know like the amount of details of how WIS can do the 6 feet, like using it towards our school. So I think right now I just kind of want to see what my parents are going to have to say, what the community has to say, and kind of just seeing what like my friends and what the grade's going to do, just to see kind of my perspective onto going back and to kind of get some more insight on what we can actually do to our school specifically.
Okay, Amy?
Talking about Olivia's point for a second with regard to quarantining, one of our nurses brought to my attention that for every positive case, if we went to less than 6 feet, could amount to 12 to 20 students being required to quarantine. And she indicated also we would need, if we did that, we would need more staff in order to do contact tracing. I'm just wondering if we have staff in place already that could transition to that, or if that's something we would have to hire for, and how long that process typically takes.
The contact tracing is incredibly onerous. Frankly, we had a situation today where we had basically 3 people trying to track down some leads and whatnot. It would require more staffing. I mean, it's not a huge staffing cost, though. We could engage hourly people, so that's okay. There would be more contact tracing and more quarantining, and we should probably actually, frankly, the staff would probably tell you that they'd like to have some help now in that regard, even with 6 feet. And I'm considering that request, let's say. But if we went to less than 6 feet, we'd need a good bit more. But I don't want to suggest that that's a reason, that the dollar cost of that additional staff is a reason to factor in here.
Sure, and I wasn't suggesting the dollar cost of that. I'm just wondering how long that process would take to actually hire someone. Like if we wouldn't have anybody in place for like another 30 days to even assist with that process, if we would go to the 5 days.
I think we could get people up to speed on contact tracing if we had to. I'm presuming we could find some hourly people. It does kind of depend on when the case is known. If it's known after hours, then the hours need to be after hours. Like our nurses are incredible this year. They're working, they don't know what the normal school day is because contact tracing doesn't stop and wait for 8 a.m. the next day.
Okay, thank you.
Other comments or questions for Jim? Yeah, Alex.
I had a question that if we are going to be returning to this hybrid model, that for the 4th marking period, if there were some special accommodations that could be made for seniors and freshmen, just to even have like their own week and some sense of normalcy for the remaining of the school year?
That's a great question, Alex. And we are going to discuss next Monday, week 6 days, some ideas in place for the celebration of the seniors' capstone year. I wish I could tell you that giving a class a week together in school would return some sense of normalcy. Maybe it would, because maybe they'd be able to see their friends a little bit more, 2 more days or something. I don't know. It would be a substantial amount of work to have it be just like 1 week for a class. I think you bring up a really good point about the freshmen too. Like haven't really got like their feet down on the ground in WIS yet, at least Wissahickon High School. I think we can accomplish that with other things, these other events we're going to talk about, and maybe some things also. But I like your point about the freshmen too. We in all of our thinking about the senior class, that's a really good one. We'll give us some more thought.
Ronnie, did you have something to say? No. Oh, Amy, go ahead.
Jim, I know you mentioned that you didn't want to bring up the teacher perspective, or that you spoke just generally about it, but have we heard specifically from the WEA about their thoughts on keeping status quo versus going 5 days, how they feel?
No, I have not posed a question of them. My preference would be to keep them out of the crosshairs of this, shall we say, conversation. There might be other words for it in some circles, but we certainly could. I think part of the issue, I think the vaccinations of teachers is a little misunderstood in the sense that, yes, the teacher themselves is now vaccinated, but there are people in their homes that aren't. So it's good because our teachers are in person, and it's good because, as Dr. Rubin said, they do interact with one another in addition to the students. But there's always that layer of worry about what they're bringing home, or for that matter, what the students are bringing home to people in their house who aren't vaccinated yet. So we could ask the WEA, but in informal conversations, they're very much in favor of the 6 feet. And I can tell you that they think that this year's approach to live streaming is incredibly, shall we say, second choice.
David, I saw you have your hand raised, and then we'll go to Marshall.
Thanks, Joe. Yeah, My feeling is that we should continue to do what's working. We have had some success with the approach we've been taking since September. The case count in the county is still at a level that's 4 to 5 times where we were in September when we started the school. It's coming down, but it's flattened, Dr. Rubin said. So I think there's still a significant concern about transmission and the reducing the distance to less than 6 feet. We're going to have to find other ways to mitigate, as Dr. Rubin pointed out. And I think we kind of pulled out all the stops when we started this back in the fall. I'm also concerned, as it's been pointed out, that changing the rules midstream for those who chose the hybrid approach, that they would then be forced to change their decision. And I'm not hearing more from one opinion or another, outside of school or the parents, that one side or another wants this or that more than one approach. So I think we should stay the course. I mean, testing and vaccinations are going to be positive and help mitigate things that, but it's going to be a while still before those are in full effect. And we have a responsibility, I think, to the larger community to do what works and to continue to do what works while we're still in the pandemic. I like to see kids back to school just like anyone, but I don't think we're there yet. I would support staying the course myself. Thanks.
Marshall, and then we'll go to Ronnie.
Yeah, Jim, I just wanted to make a point of clarification. You mentioned that the staff was vaccinated. It was my understanding that a part of the staff was vaccinated last Thursday, part of the county program, and the next part of the staff is going to be vaccinated some weeks from now, meaning that once it takes effect, we're probably looking at 4 to 6 weeks until they're fully vaccinated. And that's just the ones in the program that we're aware of, not the ones that we don't know what they're doing on their own, correct?
Well, as it turns out, just today, this afternoon at 4 p.m., we got word that the balance of the Montgomery County staff across Montgomery County who want to be vaccinated most likely will be within a week.
Oh, good. Good news.
They got more vaccine, and they so far, in our case, about 2/3 were vaccinated, as you mentioned, on Thursday. And it appears that we'll have the other third that wants it. There will still be, say, 10% or something, I don't know the exact number off the top of my head, who prefer not to.
Jim, is that teachers or all staff?
All staff, including support staff, actually including contracted staff such as food service and transportation. There's a question about whether it includes volunteers, but in any event, there will be a much or accelerated time frame, much more than we thought originally.
Ronnie?
Someone said to me, it feels like we're running a marathon. And if we stop all the precautions that we put in place, it would feel like we're sitting down at the last 100 feet before the end. So that we should just keep the pace and do what we're doing. It's working and we're almost there. That's what I would like to do.
Paul.
I have 2 questions. First question, Jim, we talked a little bit about the teachers. What would be required for teachers to make the adjustment to 5 days in school if that were an option? I mean, would they have to completely redo lesson planning? Would it be, how onerous would it be for them to do that? How realistic would it be?
It would be extremely onerous if we had hybrid and in-person and virtual. The 3 different classes of students and trying to keep track would be bad. Because then you'd have a situation where your lessons would actually need 3 parts in some sense. But if we ditched hybrid entirely and went to 5-person, it wouldn't be that bad. It would just be changing, they would be changing their concept of every other day to every day. There'll be some adjustments, and the schedule has been crafted such that it's a hybrid with office hours and things like that. We might need slight adjustment, but I would say the real issue would be having 3 options at once versus 2.
So would it be that we would have to eliminate the hybrid option, do you feel, to do this within the time frame that we're working with?
Well, that's a question that's been posed to me with some flavorful language in emails. And let's just say that we could do 6 different options if we wanted to. Every time we add an option, though, it adds an element of complication to the daily routine in the classroom and daily planning. So yes, like I know North Penn, I think, for example, is offering hybrid. I don't know about their teachers' reaction to that. I know that Colonial eliminated their hybrid for the reason we're talking about. It's just kind of like there's no perfect here, and to offer more choice would to students and families would be to create more complication in the classroom, and schedules and routines and to some extent lesson planning. I don't want to minimize that, but frankly, the year's been turned on its head anyway with lesson planning. I mean, teachers have had an incredible year of adjusting their lessons, and they're basically their whole way they've been teaching to adjust to what we have to face here. So yes, they'd have to adjust again for 40 or some odd days. They can do it, but it would not be without effort.
Okay. Two more quick questions. Is there an option if kids have demonstrated a significant challenge, hardship with the virtual learning, or obviously kids that have have a designation with them are probably already in school, and we have separate conditions that will satisfy them. For those who are not within that category, but do have significant hardships that could be emotional or even in terms of their education, is there an option to bring in a small group of kids as the middle ground that we're talking about, kids that are realizing the most severe hardship, to be able to bring them in on a more substantial basis, maybe 4 or 5 days?
We've got a number of things in place to try as best we can to address the kids who are either entirely disengaged or partially or just struggling, like you say. I don't think it's a viable option to bring in some students to offer this a 5-day opportunity for some students, because I think we'd find a lot of people defining struggling in a way that they feel would qualify themselves for the 5 days. And because the fact is, students are struggling, and even students who are getting good grades are struggling with the isolation and all of the other things that the pandemic is bringing with it. I don't think we could call that number in such a way that would make us confident that we found just the students who need it for academic reasons or just mental health reasons. There are a lot out there that need a lot of things right now. And we haven't even touched on the students who have to be 100% virtual for whatever reason at home. I mean, they're having a hard time as well.
Understood. And last question is regarding transportation. Is it feasible that we could, from a transportation perspective, even consider a 5-day in-person without substantial disruption?
Well, we could, yes. It would just be much more crowded on the bus.
And so we could be talking about 1 foot or no distancing.
Well, what we've learned in pandemic is many fewer people take the bus, so it'll be hard to predict. There will be more on the bus than there are now, and there'll be more cars every day than there are now. I don't know if there's any way we can accurately predict, well, of the 100 more kids coming in, 70 will take the bus. I don't know. There'll be more on both. So distancing on the buses will be less, and the number of cars at each school will be more.
Okay, thank you.
I'll take a comment from Tracy and Amy, and then what I think do after Amy's comment is open it up to public comment so we can hear for some of the folks who are watching online before we come back to some additional and final board comments. Okay, so Tracy first and then Amy.
So I just wanted to clarify, for right now, the way we have it with hybrid and virtual, the kids that are virtual are on the screen in the classrooms with the hybrid children, correct?
Right, yes.
So if we were to go 5 days in and virtual, then the teachers already are going to have the computer screens in their classrooms still with kids on virtual.
Yes.
Okay. I just wanted to make sure I was understanding that correctly.
For the balance of this school year, I want to be sure everyone understands that come fall, we're going to try our very best to do away with the live streaming because that is very disruptive.
Jim, you touched a moment ago on mental health. I'm just wondering, what are we as a district doing to help our students with mental health struggles this year? I'm sure many of our students are having those issues. So what are we doing to help our students with that?
Well, we're offering, in addition to the normal array of things that we have for, say, guidance counselors' expertise, or we can actually offer some other people's expertise in student services. We have a number of things in place. This is primarily now at the secondary level to reach out to students who we know are really struggling. And it could be for grades or it could be for just coping reasons. We have actually have a really awesome Twilight program as an example, where some students who just aren't making it work at home, but maybe have to be home during the day, maybe they care for their younger sibling or something. We've made it possible for them to come into the high school and do some work with a highly skilled staff member helping. Visited this program in the audio, and it's awesome. These kids are like, they don't want to go the regular day or they can't, but they're very happy to be just out of the house and in with our staff. They get back to school a little bit. Dr. Blair gets to see them. The staff member we have, Mr. D, is just amazing. So that's an example of something we have. We've hired people to be, in a sense, not coaches, but just personal contacts, more than a teacher can do. At a teacher at secondary level, you have 100, 125 kids or so on your roster. Our coaches we've hired know that Johnny and Mary are struggling, so they actually reach out. It's one-on-one Zoom. And when the warm weather comes, I would envision house visits, not inside, just outside safely, just sort of checking in, saying hi. Doesn't really have that much to do with your algebra grade, but it does have everything to do with you knowing if somebody at school cares about you.
Okay. I know we
Sorry,
have
Jill, one quick question to follow up on that. Is that just at the high school level, or are those services also being offered at the middle school?
We've noticed that the real issue starts in 8th grade for whatever reason. So it's primarily 8 to 12, but it does extend on to other grades as well. If we find somebody who needs it, we're happy. We have a teacher on special assignment, Whit Yost, who's one of our very best teachers. And what he does all day is what we're talking about. So it could well extend to younger grades, although in that case, your teacher load is 20 or 25 or so. You have a guidance counselor in the school. It's a little more likely to be met otherwise, but it could be any grade.
Okay, at this point, I know we've had a pretty sizable audience watching in the public, and I will go to the public comment section of our agenda and give an opportunity for folks to make a comment to the board. So if you wish to speak, you can use the raise hand feature in Zoom. And when your name is called, please unmute your mic, say your name, your municipality of residence, and the topic that you're speaking on. Please limit your comments to 3 minutes, and we will allow a maximum of 5 speakers on the same topic. And It's the board's practice not to engage in a back and forth dialogue with speakers. And with that said, I'm going to check the queue. I know there are several hands that were raised earlier. Let's check where we're at now. Okay, in the order that I see them listed, I'm going to start off with Bridget. You can unmute and start. Bridget, are you there?
Hi, Bridget Giordano. I'm a parent in Lower Gwinnett Township, and I have a daughter at WSD Middle School. I wanted to comment on the recent study from the Clinical Journal of Infectious Diseases about the 3-foot and 6-foot transmission in schools that came out, and how they found no discernible difference in the 3 feet versus the 6-foot distance. And with all this new data that's coming in, on top of the vaccinations, on top of taking time off from school last week to get teachers vaccinated, why wouldn't we use all of this new information that's all going in the positive direction to make different decisions? I know in my workplace, we make different decisions all the time with regards to COVID, and there are no children, it's all adults. We all have to go into work all the time due to our environment. And we can't always follow those 6 feet guidelines either. And we have not had transmission. So just from personal experience, I haven't had transmission. And in reading all this new information, we haven't had transmission. So why wouldn't we, with all the new data that parents, educators have available to read, not survey our community to see who is interested in a full 5-day in-person option? Because by not surveying to find out who's interested, we have no idea what percentage of parents and students would choose to go in person and who would choose to stay home. And until you have that data, I don't know how you can eliminate an option. Because I know people are concerned about taking away a hybrid option, but by not offering an in-person option for 5 days, you are in essence taking away an option from my child and from my neighbor's children. So I'd like you to think about using the data that's out there in the public for everyone to read, and can we make better decisions with the information we have now than what we had 3 months ago and 6 months ago? Because I think as people learn more and people are vaccinated, or people have had the virus and now have antibodies, people will change their minds, but you can't know that until you give a survey out to the public. Thank you.
Thank you. Next up, we have Teresa Williams.
Yes, hi. I'm just concerned about the children that are at high risk. How can you guarantee that they will not be affected or keep their best interests at mind, at heart? How is that going to be affected, the children that are at high risk? I understand that the parents want the children to go back to school. I understand that, but some parents have children that are at high risk, and that's a concern to me. But thank you for your time.
Thank you. Next up, we have the Schaefer family.
Hello, this is Paul Schaefer. I'm Lower Gwinnett Township. I have one child in Lower Gwinnett Elementary, one at Wissahickon Middle School, and one at the Wissahickon High School. And I actually liked Ronnie's analogy to a marathon. I think the Wissahickon School District has done a great job leading the way this year. You know, my daughter at LGE has been in 5 days a week from the beginning of the year. It's been the best year of her life. She loves it. I think we've done a great job leading the way. The top doctor, Dr. Rubin, had some great points. The social isolation on these secondary kids is really taking a toll. And he said, quote, "I don't think you'd go wrong to go for it." And I think Ronnie's analogy is great. We're at the end of a marathon and we can coast to the finish. We can go hybrid the rest of the year. But the 2/3 of Montgomery County secondary schools are going 4 or 5 days a week. They are going to sprint past us. Now is the time that we need to kick. We need to sprint. We need to stay out ahead. We need to give these kids the opportunity for 2 months, especially the seniors, the freshmen, the 6th graders, the 8th graders. All these kids have never seen their classmates, the full classmates. We need to give them 2 months to make memories, the seniors 13 years of their life. They deserve 2 months to see their friends and just have some sense of normalcy after a full year of suffering. And we need to just make that option and give it to them. I will say that the last thing Dr. Rubin said was, do the best you can and get your kids back. Thank you.
Thank you. Next up, we have Aaron Cherney.
Hi, I'm Erin. We're in the Ambler Borough, and I have 2 children at Shady Grove. I just wanted to emphasize the level of the mental health concerns. I'm in the field of social work, and I see it every day, how much this is affecting children and adults. The suicide rates are increasing. The county's already had at least 12 suicides this year. And unfortunately, the trauma that this pandemic is going to cause is going to be a long road ahead. I would encourage community members to research the county suicide task force and prepare for the long road ahead with the mental health and the students. Thank you.
Thank you. Next up, we have DS.
Yeah, this is Dick Stanton. I'm a resident of Lower Gwinnett and a former board member. I'm appalled that we're in the tail end of the Montgomery County schools that are not opening. It is your job to overrule this superintendent's recommendation. You have coasted through this year with the most minimal of efforts, and the arguments that he is making tonight are just absurd. Oh, it's too hard, it's too complicated to do contact tracing. Do the job. You're the 4th highest paid educator in Montgomery County. Do the job. If you can't do it, fire him. But open the schools back up. The kids' mental health issues are paramount here, and you have overwhelming evidence from all around the world that opening the schools is not going to be the most hazardous environment that we could provide. So the mental health issues of these students far, far outweighs any risk that we're taking, because the risks, as science has shown, are minimal. Open the schools back up. I fought to override a superintendent's recommendation to close Madison Avenue. It is your job to do the right thing for this community, and opening this school, these schools are the right thing to do. You need to assert your authority. He works for you and you work for us. Open the schools.
All right, I think he's finished. Thank you. Next up, we have Mark.
Hey, good evening. It's Mark Giordano. I have a child at Shady Grove and a child in the middle school. The word normal has been used an awful lot tonight. It's also been on some slides from Dr. Crisfield. Just so we're clear, there's absolutely nothing normal about a child sitting alone in the bedroom all day. Nothing is normal about that. And this talk of taking the easy way out and just coasting the rest of the year, and well, the year's almost over, we'll just deal with it next year. It's just embarrassing. You've got to get our kids back in school. You are all adults. You all had an 8th grade graduation in 8th grade year. You all had a senior year in high school. No one made you stay home. You just told me, the whole school district, that the teachers are going to be vaccinated, the ones that vaccinated, in a week. At this point, once they're all vaccinated, there is absolutely no reason for our kids to not be back in school. Please use some common sense. The fact that Cheltenham and Abington have now lapped us, they're way ahead of us now. Their kids are spending more time in school than my kids are. It's embarrassing. It's a joke. And this whole 6-foot thing, that's from some German doctor from like 150 years ago. Use some modern stuff that was done this year in Massachusetts in the United States of America. It says 3 feet. Please, please get our kids back in school. That's all I have to say.
Thank you. Next up, we have Jen Rappaport.
Hello. Hi, I'm Jen Rappaport. I'm in Lower Gwinnett Township. I was just calling again, like the Dr. Rubin said earlier, as far as, you know, we should really go for it. I think a lot of parents now, with the new evidence coming out about transmissions, and also with staff having the option and the choice to get vaccinated, really think it's time. We have a lot of kids suffering that need to get back into the school. And, you know, we vote for the school board, and we really need you guys to help us out and give us the choice, give us the option. If we need to vote, we'll do it quickly. We don't care if it's only, you know, 4 weeks left or 6 weeks left in school. We want our kids to have a year this year, and we need some of them to get back in and return. That's all I had to say. Thank you for your time.
Thank you. Next is TJG.
Hi, my name is Tara, and I have Tara Grafe. I have 3 children, and one in 12th grade, one in 10th grade, and one in 7th grade. And I agree with a lot of the parents that just spoke ahead of me, that all I've been hearing from the district is all the things we can't do. And saying that parents chose hybrid, the only reason I chose hybrid is because it was the only in-person option at that time. And to not survey the parents ahead of this meeting is really disappointing. And it just shows that the district is not interested in changing things as things improve with this pandemic. And lastly, the slide that said 100% virtual in the fall is going to be an option. I really hope that in the fall, teachers are not going to have to teach to teams and also in person at the same time. I mean, that's 5 months away, and I really hope that that doesn't, you know, occur again when you're making your plans for the fall. But in any case, I really think we need to end the year on the right path and see what we can do with these kids. And the first step is that is sending out a survey to the parents. So I appreciate your time. Thank you.
Thank you. I see 3 more hands raised, but one of them looks like a repeat. So I'll allow for next 2 speakers. First one up is Christine.
Hi, my name is Christine Krasnowski, and I live in Ambler. Dr. Crisfield said students are struggling. I just want to say you're not doing all you can to get kids back, and that's why they are struggling. Frankly, it is embarrassing. Students should be your sole focus, your only focus, and not the fact that changing the instructional model will be hard. Of course it will. North Penn is doing it right now. They're the largest school district in the county, and they already have hybrid, virtual, and 5-day. If they can do it, why can't we? A survey should have been done months ago to ascertain family interest in the instructional model, how many days they wanted their children in school. From there, we should have been measuring, shifting space in schools, and reorganizing to see if we could fit our students while maintaining the 6 feet separation. Many of my daughters' both of my daughters in their classes, they only have a handful of students. I think if we survey parents, we'll find out who actually wants their students there. Hybrid, virtual, and 5 days. You can probably tell I am frustrated. I'm very upset with Wissahickon that we are behind the other schools in terms of our efforts to get our kids back 5 days a week. They have to be there. They have to be there, whether it's tomorrow, next week, or a month from now. It has to happen by the end of this school year. They cannot go over a year without being in school 5 days a week. It's not good for their emotional health. It's not good for their education. It is negligent, lazy, and harmful to our kids. Thank you.
Thank you. Next up is KAB. KAB. You can begin. There might be some technical difficulties there. The next up is Teresa Williams, but I think Teresa Williams spoke earlier, so I'm going to skip and go to Roshan Amir.
Yeah, so I'm a senior at the high school, and so I think there's only one class where I have other seniors in my class to talk to, and I definitely think that. And I was listening to what the doctor was talking about earlier. I think it's definitely possible. It's going to be hard to go back, but I think that we're currently, even though it's possible, all the efforts are not being made to attempt to go back. And I think if we make the efforts, it's definitely possible to make it safe while also improving the experience of all the students and teachers, especially with teachers now being vaccinated and them being the primary spreaders. That's all.
Thank you. And our final speaker will be Claudine Niffin.
Hi, my name is Claudine Niffin, and I have 3 kids, 1 in middle school, 2 in the high school. I just want to say, first off, it does sound like Dr. Crisfield's getting a lot of heat on this. And I, for one, my kids have all stayed virtual. We have opted to go with the high schoolers into hybrid only if it's as it is today. And we didn't take that decision lightly. We've seen what's happened in Wissahickon. We think they've done a good job. And we would not be wanting to go in for 5 days. And I'll tell you that I hear a lot of parents calling and saying that Dr. Rubin said we should go for it. I didn't hear that. I've been listening the whole time. I did not hear him say, go for it. I said, he said 6 feet where you can, et cetera. And I think that Dr. Crisfield has made a lot of good points as to how that is just not going to be possible at this time. The fourth marking period starts April 5th. That's 2 months left, maybe 3 months left of school. My daughter was counting down. It's 40 some days that she would have to be in school, that she felt like she could do that safely. I just don't feel like, there are a lot of parents. I'm not saying they're not. There's 50 some parents that wanted to see 5 days, but what about the other hundreds of parents where their kids are virtual? That the school has done a ton to get these kids help. And like I said, all my kids have been doing that from here. And we have been really impressed with what the teachers have been able to do. I feel like the hybrid's working. You're changing it up now. I get that people want to go in 5 days a week for their kids, but what about everyone else's kids? If you're that passionate about it, you should talk to the school and maybe your kid can go in for 5 days. But I don't think there's anything normal about a pandemic. And I don't think that if you go and look at all the different school districts, I went to a couple different websites, they don't all have a cookie cutter way that they're doing it. They have bigger schools, they have different rules. I just feel like we all need to take a breath here and maybe see what the community wants. I'm okay with doing a survey again, but by the time you do that, I think you're going to see there's a subset of current hybrid kids. The last thing I want to say is I think only 25% of the kids are in the high school today doing hybrid. So I think that shows you that would be a small subset of that 25% that would then went 5 days. And you may see that you're having more virtual, and you're hurting the other kids that wanted to go in hybrid and are happy with that. Thanks.
Thank you. We are well beyond our typical limit for speakers on the same topic. And I'm starting to see some repeat customers with their hands raised. So I'm going to end the public comment period for this evening. Thank you to our speakers for letting us know your thoughts. And I'll return now back to our agenda and continue with board comments. Any additional comments from board members on the topic? Tracy?
I have a comment. The last speaker, when she said that 25% of the kids are hybrid, is that correct?
I think that was probably more that in the high school, there's been fewer students wanting to come in. So perhaps effectively on a given day, there's only a handful in some classes because of the aversion to hybrid. It's much different in the middle school.
So
Jim, I guess,
what's the ratio?
what's the percentage of students, high school students, that have selected hybrid? Not who shows up on a daily basis.
Don't have that off the top of my head right now. I know that in middle, it's about 2/3, maybe even a little higher. Now, I think there's a big difference between how many people selected and how many people show up on a given day.
Right.
It's about 50% or so, roughly at the high school level. Roughly.
So then I guess like on a hybrid, in a hybrid setting, if you split that 50% up into an A/B schedule, on each given day, that's 25% then of the total population. So that maybe that's where that number's derived from.
Yep.
Other board comments? Yeah, Amy.
Several of us have mentioned about the possibility of doing a survey. Is that something that we could get out fairly quickly and do if we wanted to do a survey at this point?
Is that to me or?
That's to you, Jim. Yeah, sorry.
Certainly can do anything you'd like.
How quickly could a survey get out if we decided we wanted to do one?
We could send it out tomorrow, and however much response time you like, we could set it exactly however you'd like.
I mean, to me, the question is, if we wanted to survey, we should be clear about what we're actually surveying, and we should be clear about what our intent is and what we expect to do with survey results. So if that's something that we're thinking about doing, we should get some clarity about, again, the intent and the purpose and what the actual outcomes that might lead to. Zeffie, is that your hand raised?
It is. And I'm in the same vein as you. I do want us to think through and discuss and kind of come together as to exactly where we're trying to go. I mean, I think there's a few open questions. One is the, kind of the 6 foot rule or guidance, and how much or how willing folks are willing to give that up. But then what are we going to do about that? And then what are the options that we're going to offer as a result? I don't think I know where we're trying to get to. So I think there's more that needs to be kind of fleshed out. And
Yeah.
I'm not clear, Joe, as to what was our goal for tonight?
I mean, our primary goal for tonight was to have an opportunity for deeper discussion about the instructional plan program, the options going into the final marking period, an opportunity to hear from a medical expert, Dr. David Rubin, who came tonight, for the opportunity to do some Q&A on the topic. What I would say, based on what we've heard and based on some of the discussion, there's some sentiment among at least some board members about doing a survey. This is not something that Jim was suggesting to do on his own. So if, number one, if there is majority support from the board to have Jim conduct a survey, then we should also provide clarity on what the intent and purpose of the survey is and what we sort of expect or want to get from whatever survey results we have. But first things first, I mean, I think it goes kind of back to my earlier question, early this evening. Is there a majority of the board that is willing to entertain a different course of action than what we're currently doing? Because if the answer is yes, then we can talk about what are some of those things we should do to figure out what another option or another plan should be, like a survey being part of that. If there isn't majority support from the board to change course, then it's a moot point. Then we stay the course and move forward as is.
Okay.
I mean, that's my perspective on this. I mean, we all have our own individual thoughts, but I think before we direct the superintendent to do something, we should have some clarity that we as a board, where's the majority of board sentiment lie.
Yep, I agree.
Okay, Amy.
For me, it's hard to say what I would say I would want to do differently without having a survey done. If we know it's a very small number of students that would want to return, and Jim tells us it's feasible, yeah, there's 50 kids that want to return, and it's feasible to have those students return to school and maintain close to 6 foot or 6 foot of distancing. That's a different scenario than the survey coming back and saying we have 500 students that want to come back to school, and Jim says, well, with that situation, we're not going to be able to do 6 feet. It's going to be closer, to 3 feet. Do we want to go in that direction? So I don't really know if I'm prepared to say yes without having that survey being done and knowing what type of interest we even have in returning to school.
Ron, and then Ronnie.
I think one of the problems that has been brought up is all those students who were supposedly on the hybrid plan don't seem to be showing up, certainly not with any regularity. And there's some question as to why that is so. Is it because they don't want to be in a school with just 2 or 3 fellow classmates in the classroom physically? And the odd feeling of being out there by themselves forces them to not show up again. But we might end up, if we do this survey and we don't get enough a mass of students, we might have the same situation that we have now.
Ronnie?
I think a survey is a good idea and lets us know what the community thinks. After we find out what our families think, we'll have a better way to make a decision.
Tracy, and then Marshall.
Yeah, so I would say what we need to do is poll the board to see if people are interested in moving forward with looking at a change or staying with the status quo. And then I think that we should figure out what exactly we would want if we were to do a survey, what we would want, how quickly we would want to have it. I mean, honestly, if we could put out a survey tomorrow is Wednesday, correct?
Mm-hmm.
I would love to see it close on Friday and have the results for Monday. Parents would know right now what they want to do. You make your decision. We have it by Friday. They tally it up. We have it, we close it on Friday and then we tally it up for Monday. But right now, what we have to do is vote to see if we have enough board members that would like to see at least a survey done. Not saying that we would change anything, but at least a survey to find out what the community is thinking.
Marshall?
Yeah. Tonight's purpose, I think, was to do several things, as you said, including find out what the pulse of the district is. I think we've all been speaking to people separately, or even in small groups, about what they'd like to see, and it sort of runs the gamut of what people would like. I think if we did this in a formal fashion, it's probably the best thing to do, but I think it also needs to be tailored. And we don't want to inundate people. We don't want to overwhelm people. I think if we do it very simply and basically put several questions together about the options that could be provided with the proviso that this is how it could work. So you don't want somebody saying necessarily, yes, I want to stay completely hybrid, when they could have an option that they feel is also good for them within parameters that they feel are comfortable. So I think if we narrowly tailor several questions to make it easy for everybody, where they can put forth their opinion, I think that's a good idea. Everybody should have an opportunity to say this. Frankly, we should have done this weeks and weeks ago. I know a lot of us started in January saying that this is going to come up, like other issues are coming up now. So regardless of whether it was 2 months ago or a month or whatever it may be, we have an opportunity. So let's take the opportunity, I think. Let's find out what people want. It'll help us, and then we'll make a decision. And look, as everybody knows, we have an administration, they're professionals, and we have an obligation. We can figure it out. We always do. And if we need to figure it out in a way that we weren't anticipating or weren't thinking, we'll figure it out. So let's do it in chronological order. The first thing is set up some reasonable and appropriate questions. Let's find out from people what people want, and then we'll go from there. That's all that should be done at this point. And I think it'll be helpful to everybody.
So I think right now, what we need to do is find out if we have the support to do at least a survey.
All right. So you want to use the raise hand button at the bottom if you are supportive of or want the superintendent to conduct a survey of the parents to find out their options.
I don't know where the raised hand at the bottom is.
Put your mouse towards the bottom of the Zoom screen. I'm trying to do this in an orderly fashion.
All right, well,
You
I
guys-
still
you guys
can't
see-
find it.
I know that I'm not voting anyway, but just like I don't actually have that option. So
Oh,
I
you
don't
don't?
just, yeah, so it
Do
could
you guys,
be
I see like Ron, Amy, and Zeffy raised their hand. No, Marshall, you don't? Okay, Marshall, do it the old fashioned way.
For
Okay,
those people who aren't graced with a button, they can just use one of these.
well, I have counted more than 5 hands raised. So the consensus for the board is, Jim, for you and the team to conduct a survey of the school population. I think Zeffy should know this because she's a marketing professional. The details matter and how we construct the survey and what we're actually asking. Rather than getting it out quickly and maybe unclearly or shoddily, I'd rather us take a minute to step back and be clear
Yes.
about what we're asking and how we're asking it to make sure that we get the kind of insight that we're hoping to get from polling the school community.
Yeah, thank you, Joe, because that was going to be one of the things I wanted to raise was let's not be too quick. I want us to be clear and thorough in the questions that we're asking. And, putting up a Survey Monkey is no big deal, but putting the right questions together is the big deal.
Mm-hmm.
All right, so here, I just want to throw out my suggestions on what I would like the survey to say. The first thing I think we should be asking is, what are you now? What is your child right now? And then give the options of 5-day, hybrid, and virtual. What would you like your child to be in the next quarter? Those 3 options. And then the final question would be, if we go to a 5-day, would you change your child from hybrid to virtual? Because that's really what we're looking at, right? How many people, if we go to 5-day, are we forcing out of hybrid into a virtual setting? How many people are interested in doing a 5-day? And then how many people would feel like they would be forced out of what they're doing right now as the hybrid?
I also think that you need to account the other way for kids that are currently all virtual that would go fully in. Like the kids that aren't staying home because there's concern about safety, but they could throw off the numbers. Like I know people that are staying home just because they don't feel like it's not worth the hassle to go in every other day and figure that's good. So those like people leaving hybrid because they're not comfortable with the safe could be counteracted by people going in because they're just excited to be in school that like regularly.
Yep, that could be another question.
David, you have your
Yes,
hand up?
I think we should also include the information somewhere in one of the questions if your decision would change, knowing that we would be in closer proximity than the 6 feet that we're observing now. How would that affect your decision? And any other variables that are going to change have to be considered as well.
Our experience with surveys is such that, let's say we somebody provides the exact wording you would like us to survey, say at noon tomorrow or something. Many people can get right on a computer and do that and have it be understood and maybe comfortable with English or what have you. I'm not sure that you're going to hear from quarters that 2 days, 48 hours is enough sufficient turnaround time for, say, maybe families where English is not the first language. Now, maybe we just want to redouble effort to somehow get them to participate, but I'm just sharing what our experience has been on surveys with really quick turnarounds, is that we just don't get participation from certain segments of the population.
I agree.
How long did it take to get a response to the surveys when we asked for the choice for the spring, the January?
I don't know how to answer the question. It's a good question, Dave. I would say that we have typically allotted more time. Let's put it that way. I mean, I don't know, maybe 5 days is a typical amount of. Now, that's not to say that people need to think about things for 5 days. It's more that if we really want to get everyone who wants to respond, 2 days, 40 hours or whatever we were thinking of is probably not going to accomplish that.
Did you not have to do a lot of follow-up too to make sure you reached as many families as possible?
We did not. I take that back. In some instances, yes, we had to call every family when it had to do with whether your child's going to be virtual or not, because we didn't know, like elementary, we didn't know if which teacher you're going to have. But in a preference survey like what we're talking about, I would not envision us following up to make sure we got everybody responding. I would just assume that people who respond who wants to, but just throwing it out there that there's that variable of time for some families.
Yeah, I mean, I'm not set on it having to be. I'm just trying to get it done as quickly as feasible. And I would think too that what we could do is, I know we don't like to shoot out the texts unless it's an emergency, but I kind of consider this an emergency. So I would say we could shoot out a text telling parents, your survey is there, please go in, fill it out, and hopefully that helps people fill it out.
Yeah, we could absolutely do that. I would just like to reiterate that we are going to need help with the questions, and here's why. Because I don't want to bring data results to you that you don't have in mind as being helpful. And so I don't know how that can work, but I don't know that I don't know what to ask right now that would be of use to you on Monday or whenever we get together next. But I know that we can certainly do it. It's just that we need help crafting the answers that will get data that you want to consider.
Zephy, you have your hand raised.
Yeah, I kind of lost track because there was so many things. So in response to David's feedback, not only should we ask about the 6, kind of get around the 6 foot, but also the understanding that, mitigation or quarantining kind of rules may change, and making that super clear. In regards to Jim's question about helping with the questionnaire, if the question is the ask from us, I'm happy to chip in and help out. I have over 10 years of market research experience crafting lots more complicated questionnaires in my lifetime. So I'm happy to help out with that, but I think it could be a group effort with this group. And then there was another thing that I completely lost track of. I'll raise my hands again when it comes back to me.
Well, I think Zephy, especially given your work background and experience, if you could take the lead in maybe working with Jim and the team to come up with an appropriate set of questions for the survey, I think that would be fantastic.
I remembered what I wanted to ask. Sorry for the echo.
Okay.
So I hear loud and clearly about ensuring that we get all the families and putting out or giving sufficient time for responses. You're never, ever, ever going to get 100% response rate, but we do want to maybe think about, and I don't know what this is, and we might have to look at what the past surveys look like, but we probably want to hit some sort of threshold of the type of response rate we would feel confident with having enough data to kind of make some decisions from. I don't know what that number should be, but I don't think we'll get 100% response rate. That just doesn't happen in the real world, again, from my many, many years of doing market research.
Okay. All right, so I think we have some clarity around the next steps of constructing a survey and then issuing one to the school community. Any other final business for the evening, Paul?
A question, Jim, what do we typically do for those who are either technologically challenged or those that don't have computer access? What's the typical?
Often have a hard copy submission offer. We've been able to provide internet access to all of our households. So the access isn't an issue, but indeed we have people who might describe themselves as technically challenged. So we'll have our typical hard copy option if that's preferable.
Okay, thank you.
All right. Well, it's been a long evening. We've had a lot of discussion on this topic. Before we close things out, any final words? Student board reps, any final comments? Okay.
Just one comment for the survey, just as a way of suggestion, if there's a way for us to provide links or maybe even a copy of the CDC current guidance so that people have some data to refer to. You know, some people are obviously well versed on this and have done research, others may not have. And so whatever we could offer in terms of support so that people can become knowledgeable for those who aren't, I think that might be helpful if that's possible.
Okay, Ronnie?
I have a question. What percentage of students chose hybrid for fourth marking period? Do we know that?
I don't know off the top of my head, no.
Okay.
Wait, didn't we just say that it was like 50% for the high school?
In high school, it's about 50-ish. Maybe middle school, it's going to be closer.
I think it was in the 60s.
Yeah, 68 maybe. That's that survey that went out. So I thought our previous conversation was how many are in at the high school, which is about 50. And then I think at the middle school anyway, it's about 65-ish, close to 70 who were choosing hybrid.
Okay. So Zeppi, if you could connect with Jim afterwards, or Jim follow up with Zeppi to try to strategize on the survey as a next step, that would be great. Aside from that, I'm going to ask for a motion to adjourn the meeting.
So moved.
So moved.
Second.
Second.
All those in favor say aye.
Aye.
Aye. All right, meeting adjourned.